Okay, I've got a proxy brush I'm using. I'm going to go in and now clean these two implants out. And we'll dip that again. We're going to use Dry, which is an acetone-based medium. And we need to do that to get these meticulously cleaned before we try in our plastic components to make sure that they can go in. Otherwise you could lock in, and I don't want to do that. So if we can get these as pristine as we can get them, that'll be great. There we go. Okay. There we go. Alright, we'll have to rinse that out now. So here comes some water. Terrific. Careful, metal to metal. You want to go in more at a 90. There we go. See how I bent that too? It's going straight down in there. Go in here. I gotta see if we can twirl this thing a little bit more. So I'm gonna use that other one. This one actually you can twirl while it's in there. I like that twirling action. That's better. Again, in there. I'm dipping back and forth into the acetone to clean the threads. Whatever technique you have, just you bring it in and you just scrub the inside, just like that. I just pretty much scrub until I don't see any more debris. Sometimes you got to let this material just soak a little bit and you'll get a little more debris come out. And the cleaner the better. Okay. Now I'm going to make, we're going to rinse that out. I'm going to use some water. And we'll leave some of that water in there as a lubricant. We don't want to dry it out too much.
Push your lips around here like a straw.
Great. Alright, and we'll go to our parts. And this is just an impression coping. I believe it's a 4.0 coping. So we're going to try that in the first one and screw it down in place. Now I'm checking for resistance of the path. Now it did engage. So we've got a perfect threading of number, that would be number 20. Alright, so good news for 20. 20 is right on. And we'll undo that. Okay, so thread-wise 20 is perfect. This is the big one right here. This is good old number 19. Let's see if we can go in there gently. Find a threading. Lo and behold, guys, it threaded. Okay. Now, what we want to do, back it out. Now, there's a tiny gap space I see, and maybe that might have to be trimmed, or there might be a sleeve that has to go on there. Let me double check now between this one and the first one again to see. Oh, we did mention that it's a shorter one, so that's probably why. It's shorter in length, and that's why it bottomed out quicker. That's why the gap space, so we have to find the next size. See how this one is flush with the implant? You can see that there's no seam involved here. And if we go back to this other, but the nicest, you know, the main mission was to try to reuse this number 19, and it looks like if this is threading plastic, and it's not with much force at all. There's no, you just have to find the right. Try to thread it again. Hold that. Let's see if I can get it to thread again without any force. There, I know there's a path in here. As I was successful at getting it. Alright. There it is. I got it. Okay, so you see this little gap here. Now that gap is there for a reason. That means that this implant is shorter, or there's something holding it from going all the way down. So we'll find out what that's all about. We'll do a measurement. I'll use a periodontal probe. We'll know. Then we know the diameter is a 4. I believe it's a 4.0. If the case is joined together, you can hand tighten these cases. That's the way we used to do them. Put a little wrench on them and just gently, they'll go into place. The question is, will that one hold over time? Now, when you're just replacing parts and you've got the old bridge to find out, that's no problem. Okay, so if we measure this one, let me get you in focus. About 9 millimeters. The other one is 8. So you got one at 9 and one at 8. There you go. Just shy of 9, maybe 8 and 8.5, and the other one is, it looks like at 8. So there's a definite length difference on both. At least there appears to be. All right, so that's good news. Now, I don't want to leave Ron and go off without putting something in there to keep them from getting all that work that we've done today with cleaning these out. So I'm gonna place a couple of small little screws. They're plastic, and before we do that, we do want to dry a little bit. So I've got an air syringe that it just has air only. There's no water attached to this. And I could see there's still more debris in there, so we'll work at that. That's no problem. The good news is we threaded them both, so we're halfway home. Okay, now this is just a little plastic part. We're going to put that in there. It's just going to keep bugs from getting in there. The same thing with the back one. And these are just sterile parts that we had lying around. Just going to try to get something in there to maintain cleanliness. Okay, hand tightening down. Just enough to keep the tissue happy. That back one, we need something smaller. So, what do? You custom make. So we're going to do that. I'll use a disc. I'll custom make a part. Let's see. I'm going to just keep you. Okay. Alright, we'll be right back at you to show you the end of this, and which is good to see. We're going to come back and finish this.